what we keep on hearing time and time again from the community is that healing looks very different. Some people like to heal dancing, breathing, laying down, walking in nature, doing a bunch of different things. So we wanted to have a buffet of different options that people probably don't even know about that could support their mental wellness.
Welcome to SHINEABLE, the podcast with insights and inspiration for living your best life. In this episode, we talk about mental health with Dr. Jody and Sandra Huber. They are co-directing a brand new mental health arts festival in the Pacific Northwest called MINDfest. Listen in as we find out the motivation behind their big dream to reframe our ideas about mental health. As Sandra says, there is no health without mental health. Jody and Sandra, thank you so much for coming to the podcast. I'm so excited.
Excited to be here.
Yeah, thank you for having us.
Yes. So, the listeners may or may not know this, but you two are planning an amazing event coming up called MINDfest. It's an arts festival, celebrating mental health. Why don't you tell me more about it?
So MINDfest, it's our very first year. There are a number of MINDfest celebrations around the country, but ours is a little bit different. So we're really trying to promote mental health, but we're looking at it through a holistic lens. So it's not just about mental illness. It's about thriving. It's about love, connection, learning,
Fun.
the arts. It's about all of that. So we have a very eclectic lineup. And Sandra, do you want to talk about what we have planned?
Well, I think that part of what makes this different too is that we recognize that mental health and mental wellness looks different for different people, for different cultures at different times. So we know that we have access. Many people do, not everybody, but there's access to a provider that can offer the mental health services. But what we keep on hearing time and time again from the community is that healing looks very different. Some people like to heal dancing, breathing, laying down, walking in nature, doing a bunch of different things. So we wanted to have a buffet of different options that people probably don't even know about that could support their mental wellness, because we really believe that when we talk about mental health, this is more than just mental illness, but how we can support people that are feeling strong and healthy so they can thrive and do a little bit of prevention, do some education, and to make sure that we're using all the tools that are available to community to be able to do that healing in whatever way it works out for them. So that's how this came about. And the more we looked into it, the more we're like, whoa, I never heard of a sound bath. Let's go check out what that is. And the possibility of introducing those different options to people.
I love that. And I don't know if you two know this, but I actually owned an art gallery for many years. And so I was in this beautiful bubble of creativity and working with artists. And I can tell you it was good for my mental health. Like, the arts are good for our health. Like, imagine, thinking about how good you feel after listening to live music or dancing or being creative and working with colors and everything. So I applaud you for what you're doing. Is there any information that you have in terms of can art actually save your brain?
There's been so much science behind this. So it's just now that I think it's starting to get into the mainstream. But yeah, I mean, we know, for example, in rehabilitative medicine, that doing art can help regenerate. And works on neuroplasticity, right? So there's been a lot of studies with Alzheimer patients and with those who have stroke. But it does so many other things. We also know that, and I mean art in the biggest sense. So we're talking not just, painting and drawing, but also dance, music, journaling, the written word, all of that. It can lower our cortisol levels. There was a study that was done a few years ago where a scientist had actually studied people looking at art, doing a scan and MRI in parts of their brain, and they had found that parts of their brain will light up the part that we actually feel when we see someone in a room that we love. Like the same part of the brain was being ignited as they were looking at these pieces of art. So it's, art therapists can tell this story better than I can, but it has a lot of scientific evidence to show that it can not just lower, our cortisol levels or raise our dopamine levels, but there's also something about just that healing element that I think that we're really embracing that, because it's going to look different for different people.
And to add to that, I think what is delicious about it is that we get to do that in community, because especially after the pandemic, I don't know, some of us got feral, some of us got I just don't know how to be people with other people. And this is an opportunity because we strongly believe that there is a place for solitude and for doing your work on your own, but there's also an opportunity to come together and support, and the power of somebody finding out, oh, I'm not the only one who feels that way. I'm not the only one who has had those thoughts. I'm not the only one who stumbled with that, and bringing us together to celebrate what we know that works, what we know that is true for us, but also to witness for other people in their own healing discoveries. So I think that we will be offering things during the event where you can go outside and be on your own, but there are also opportunities for you to come together with other members, getting to know other providers, getting to find out, I never knew that there was such a thing as, like sound bath. That I keep on bringing that up because it's a new thing for me. But and we were very mindful about the selections, because there are things that are very powerful and helpful for community. But if you don't have insurance, if you don't drive and can get to that provider, and they're charging worth it, but they're charging $200, $300, $400, how do we support community that is just exploring these options without, breaking the bank? So we were very intentional about that.
Yeah, so I love that you're offering almost like little samplers, right, at your event, so people can try, a sound bath, like you say, maybe some movement, maybe some storytelling, maybe some journaling. What other things are you offering?
Yeah, so we're going to be talking about nutrition and how food affects our mood. There are some fun youth activities, I should say, silent discos, and just a lot of activities that can help bring people together. And I wanted to go back to what Sandra was saying about social connection, because what we've also come to learn is that loneliness kills. It has become, honestly, a leading cause of death. There's our current Surgeon General actually wrote a book about loneliness, and it has only exacerbated during the pandemic. So connection is so important, and it's key to the work, and art is a connector. People don't have to say anything. They can show up in a class, they can sit down next to somebody, and they can start painting, or they can start, one of our sessions is heart art healing. So you don't have to be an expert artist. You can just come and paint rocks, or there's some creative ways to just be artistic and express yourself. So,
and that part of loneliness, I think it's a big part for us this year, being our first year. And I was surprised, I don't know if I share this with you, but do you know that in England they have a minister of loneliness?
They do.
In Ireland,
I did
it's
not know
called
that.
social prescribing.
Oh my God. No,
They actually prescribe when you go, that you will, here are some groups that you might, be a part of, and the fees are paid for.
Understanding that we were not created in isolation or, wired for isolation. Not to say that people don't get to have their own time. As an extrovert, for me, it's people all the time. But that is not true for everyone. And giving people the opportunity to learn about what works for them is part of what we're hoping to do.
Yeah, I love that. And I agree. I think, pulling people together, it seems like right now, especially after the pandemic, people are craving opportunities to get together. And so by you providing this, you're really inviting people in and being able to have a conversation about something that maybe people don't necessarily feel comfortable talking about.
Yeah.
You know, mental health is not necessarily the most common topic at the dinner table, but if you're having a really festive, fun opportunity and you know, you sprinkle some education in there and some connecting, I think that's wonderful.
Well, and sometimes people, I think what we're also trying to bring to the forefront is you can't really think of much that's not about mental health, right? So the way reframing, like this is mental health, like taking a walk, having a laugh, we're really trying to create a different understanding about what mental health is. And so part of that is having workshops that don't say mental health.
Yeah.
You know? And we were told that too by some of the men who have given us some advice too. It's more people may want to get together around affinity and like affinity groups than they are going to want to go to, I want to go to this loneliness prevention group. I want to be a part of that group. Yeah. So.
Good point.
I'm in the social anxiety club. Although I actually think that could go a long way of destigmatizing.
Yes.
And I teach at UW, and I've often said I want to have a class where we get back to the basics, because I think the pandemic has really hurt us in terms of, wow, people aren't that comfortable being around people anymore. But we're more uncomfortable to see that we're not comfortable around being people. So what if we just did? You know? So.
Yeah, I definitely think we're still in this transition, and it's affected everybody coming out of the pandemic. And so I applaud you for what you're, doing. And it's quite a big effort that you've taken on to get this festival going. So tell me a little bit about how you two met and how you worked together, and who came up with the idea.
So to me, it's been an amazing journey, because we met about 8 or 10 years ago when Jody was recently transferred here from Texas, and it was completely one of those that I didn't want to go to the event. My friend at the time made me go, and then we met, and I was starting my work with promotoras, with community health workers, and she had expertise and experience with that. So we connected, and we've been working together in different projects at different times ever since, and it's been a blessing. I've learned so much. We have worked through a lot of things, both in community and individually, because I believe Jody believes too, the importance of growth. But we have had different projects, great, and then in 2020, the pandemic was really hitting everyone, and if you were not sick, you were sick from watching other people be sick, and we realized the impact of mental health that was having then and would potentially have. So Jody came up to me and said, what do you think about what we know how to do? We know how to train and guide promotoras, community health workers. What can we do with this? And then we started thinking that even if everybody graduated and licensed and was ready to go, we wouldn't have enough. And we were very aware of the pain communities, particularly communities of color, because we were in it. We could see it. So so she took a big risk and said, you want to partner on this and see if we can get a grant from Verdant Health Commission, and we did, and we got it, and then the fun started because we had a big idea, but the need was so great, and it was just the two of us at the beginning. And thankfully we have, through the 2 years we've been doing this, have been able to add staff, and it's like a family. There's 6 of us. This is not a very big outfit, and what I love the most about the effort, there's some days that we're like, oh, what are we doing? But there's some other days that we realize the impact it has had personally and professionally, and the way the community has responded to our efforts, and how we continue to hear from nurses, firefighters, cops, that they're like, could you train us to do that? And I have to be totally honest, we're still flying the plane while we're building it, because it just continues to expand on the possibilities, and we're so centered in a community that it's been hard to say no to groups and organizations that want specific customized training. But from the beginning, we were focused on supporting community, the grassroots level, and that's what we continue to do. And I don't regret a single day. We've learned so much, and this is it's been a journey that I'm very grateful for. Yeah.
Yeah, I think she's covered a lot of ground very well. Yeah, I would just add to that the model that well, first of all, I also want to say that from a personal standpoint, this work's very meaningful for us. We as caregivers have family members that have mental health diagnoses, and what was really striking for me a few years ago when my daughter was first, not even before she was diagnosed, but we were going through a pretty dark time, was that even me, having worked in healthcare public health for 25 years, found myself in a situation where I was like, I don't know what next thing to do. Who can guide me? Because, now it's even worse. You can wait for a long time before you're ever going to see a psychiatrist. So it really started from the very beginning of like, what can be done early to support people to be able to, even talk to people who have gone through it. So luckily, Sandra and I have also that in common. We're able to share that. But yeah, it's really, I think it's the heart of our work. It's just really wanting to help people. And also thinking upstream. So we think about prevention, we think about in other health issues, right? Like exercise and cardiovascular fitness and brushing your teeth for oral health care. But we don't think about what are we doing for our mental health? We're always thinking crisis mode. So that's really, something else that we look at more of that. Also, like the everyday prevention, the conversations we have, how can we be helping people in our everyday lives, including ourselves?
Yeah. And that's so important. A lot of the people I work with, the yoga, instructors, the healers, the dance instructors, people are really trying to incorporate that into your day-to-day life, where it's important. This is a priority, as opposed to working yourself and getting so stressed out and not having enough sleep, and then you're sick, and then you try and get healthy. Right. What if we just build a really healthy lifestyle to begin with? And I think it's super important. I know you're doing a lot to work with youth and to bring, in people of all ages, which is really great, because it's never too early to start.
Yeah, and the idea that we feel very strongly about, that there is no health without mental health. Yeah. And we have, unfortunately, as a culture, divided the mind and the body as if they're two different things that need to be, tended to in different ways and separate. And we all know that is not the case. And identifying opportunities for people to make that connection, and if we can. Because there's intersectionality. I mean, mental health in our LGBTQ community, it's challenging to find providers that are what our community needs in so many different areas, that we keep on learning. Like the part that it never occurred to me that we're exploring now is neurodiversity. How did I not think that somebody who had a diagnosis, whether it was autism, bipolar, or whatever, they also have their own specific needs for mental health. Their youth support on mental health, emotional health, it's a little different than adults, but we're also seeing vets and we're seeing seniors that are having, so you realize that it's a universal, whatever you call it, but it's a universal experience that people in my culture, in the Latino culture, we don't say mental health. We say emotional health, because we connect our emotions to our feelings to whether we're healthy or not. So I think looking at it from that perspective is opening a lot of doors for us, because there are some communities that are still struggling with that concept. So instead of going in and saying, well, we're going to talk to you about what's wrong with your head, we are thinking about how can they receive that information in a way that is respectful, culturally appropriate, and meaningful to them. So we're learning also a great deal, and putting the efforts to put communities first, in the sense that they're experts on what they need. We don't come in telling anyone, well, you need to do this, that, and the other. It doesn't work very well. It's disrespectful, and it really doesn't work. So that's why the grassroots efforts have been so productive and has been so powerful for us, because that's where the juju is. When you go in, and people will tell you, people know what they need. We just need to listen.
I love that. It's a conversation, right? And that's what you are creating, a community and a conversation, and you're learning with everybody else.
Yeah.
So, oh my goodness, I just love it. Amy, would you like to talk about like some of the keynote speakers that are coming for your MINDfest event?
Sure. So we have a number of great speakers, all talking about different things. We have our first speaker is Roxanna Pardo, and she's going to be talking about, her title of her talk is Chingona. It's about community and healing and resilience. So she's going to take it from a very personal lens, and she's a wonderful artist and activist, and she has a great website. So we're looking forward to hearing from her. Richard Taylor Jr., who is, for those in your audience that are here in Washington, he is from Washington, and he's a noted author, mental health advocate, and he's written several books. He speaks a lot about many things, but from his own experience as having someone who's come back from being a survivor of attempted suicide, but brings so much joy into the room, and that's really part of his message. Is yes, he's walked this path, but how you find joy, and how we can reframe mental health in our daily lives. So we're really excited to have Richard with us. And then we also have a panel that's being led by Dr. Lucia Magis-Weinberg from UW Seattle, with youth that are she's going to be sharing a little bit on her research on mental health and social media. And then we have a panel of about 6 youth from all different ages that are going to be talking about their perspectives on social media and mental health. So those are our 3 primary speakers, and then we've got a lot of different workshops.
And because we also believe some of these topics can be heavy and can be rich in information for people, we wanted to end the event with music and poetry and live. Yes, so for that we reached out to Movimiento Afro-Latino Seattle under ED Milvia Pacheco, that is going to bring us all together at the end with her group, because we want people to leave with information, education, resources, but also hope and excitement for what they can do for themselves and their communities moving forward. So that's kind of like the bird's eye view of the event, but it was very important for us that we brought joy, because it's going to be fun at the event, and then we're all in charge of taking this forth into our communities, into our personal lives, and hopefully we can do that with joy.
I love it. So the event is called MINDfest, and it's this year, depending on when listeners are hearing this podcast, it's May 7th, 2023, and Rose Hill Community Center in Mukilteo.
Yes, a beautiful Rose Hill Center.
Oh my gosh, I love that place.
Like the water. Yeah.
And then if, so if you're hearing it after this date, then you'll be talking about the next year, right? Because this is an annual event that you're creating.
We hope so.
Yeah.
We'll see, but we're optimistic. We've had a lot of interest since we've put this out into the world. So some of your listeners, some of your watchers might be interested in joining us. Doing some workshops next year.
Yeah, it is from 12:30 to 6. So, and there is no requirement on staying the whole time. So if you just kind of want to come and check us out and see what is this about, you can be there for, as long as you want to. You can stay the whole time, but at least we're gonna have the program on the website, so you can
Mental
see
Health Matters WA.com.
Okay, so the overall organization putting this on is Mental Health Matters.
Mental Health Matters of Washington.
Of Washington.
There is a UK Mental Health Matters.
Okay.
So, but mentalhealthmatterswa.com, and on our website we have, you'll see on the top toolbar, there's MINDfest 2023, and people can see our schedule for the day, our location, speaker bios, all of that good stuff.
Okay, wonderful. And so I'm just so happy that you're here and got to know you a little bit better and understand why you're doing what you're doing. And so mentalhealthmatterswa.com. We will definitely put the links in the show notes and all that.
Thanks, Dale.
Thank you so much for being here.
Thank you so much.
Thanks for listening. See you next time for another episode of SHINEABLE. And remember, the world's a better place when you show up and shine.